Okay, and so if you would put your name and organization and title in the chat, and just like to get an idea. I know I see some new faces, so new faces. I see new names, and so would just like to kind of have an idea of who all we're hosting and who we have in the Zoom room. So. And because we have some new folks with us, I want to give just a brief overview of the Native Oral Health Network and kind of who we are and what we do. So the Native Oral Health Network, it's a program that's housed at the Southern Plains Tribal Health Board, Oklahoma Tribal Epidemiology Center. SPTHB is a nonprofit organization based in Oklahoma City, Oklahoma. And the health board was established in 1972 to provide a unified voice on tribal public health needs and policy for the 44 federally recognized tribes that are in Oklahoma, Kansas, and Texas. NOHN's mission is to build healthier Native communities by connecting oral health to overall health and wellness. And we do that through peer support, collaboration, and community engagement. Since NOHN's inception in 2017, we've grown to roughly 200 members nationwide, even kind of beyond our service area, again, which is Oklahoma, Kansas, and Texas. We work with other area Indian health boards. We work with other tribal epidemiology centers, Indian Health Service dental support centers as well, and other public health partners to advance oral health equity for the American Indian Alaska Native population. Our team, small but mighty, Native Oral Health Network team. So obviously me, Julie Seward, and we have on the call Alex Holt, who's an epidemiologist, and then Amanda J. Yaneza, and also an epidemiologist and works PhD candidate at the University of Oklahoma and the Department of Epidemiology. Okay, so we're going to hop into just some of our updates that I want you all to be aware of. Our oral health challenges and potential solution survey is those data briefs are now available. The quantitative and qualitative analysis is available on our website, and I think Alex will put those in the chat box. Can link those. I think they're on our webpage, and she can link those. Also, we received a grant from the Indian Health Service for an assessment and planning grant for the Community Health Aid Program. And what we're going to be doing, what we're starting to do is essentially a feasibility study to look at the implementation factors with implementing the providers that fall underneath this program. And for those of you that are not familiar with the CHAP program, that includes behavioral health providers, primary care providers, and oral health providers. So we're going to be working with a tribe and some other tribal partners to kind of take a deeper dive into what implementation integration of those providers look into the tribal health systems, into existing tribal health systems. The other project that we're working on is American Indian Alaska Native representation in the oral health workforce, and we're doing that through a systematic literature review. And those providers that we're looking at are dentists, dental therapists, dental hygienists, and dental assistants. And Amanda is working on that for us, and she's started kind of the first draft of that. So we're kind of expecting that report to be out the end of spring, early summer. So be on the lookout for that. The next thing that I wanted to discuss is some of our guides and publications. So we have updated our resource guide, which is the document there on your left, and you can find that on our website as well. It's just kind of a conglomerate of different links and resources and information. So take a look, and to our partners here on the call, if there are, if you would like to include any of your work or resources, this is kind of a living document, and so we're going to be updating this annually. So feel free to send anything, and we'll take a look, and we can potentially get it included into our resource guide. Also, we still have an oral health data report that we completed not end of last year, I think March of 2021, I believe. I'm not entirely sure. It's not that old. But that's available on our website that has kind of the most recent oral health data included in that. And we look at our area, the IHS Oklahoma City area, which is Oklahoma, Kansas, and Texas. And then we also take a look at the US general population and the national IHS population. And then here recently, we published a policy brief, was able to co-author that with Dr. Michelle Dennison. She's the Director of Public Policy at the Oklahoma City Indian Clinic, which is an urban Indian facility here in Oklahoma. And so we're kind of starting to promote that and disseminate that brief. And that's also also available on our website. Another just FYI for those of you that might not be aware, we just published and just finished putting together a member engagement guide that just gives those a better snapshot of who NOHN is, what we do, who we serve, why we do it. And so this is available again on our website as well. Also kind of some of the presentations that we've done, and again, just as a reminder, we report this kind of per quarter for our members and those on the call. We were able to present to OPEN, which is the Oral Health Progress and Equity Network, through their Data Stories series. And so that was actually held yesterday and was a great presentation. So thanks, Amanda and Alex did a fantastic job there. And we're growing. And I wanted to let everyone know that we're working on a new webpage that will be a little bit easier to navigate and and hopefully more user-friendly, and have things now that we're building so much capacity and we have so much content, we're needing to kind of rearrange that and make it a little bit easier to access. So that should be done, I think, within a few months. And then also we're really excited because we're working with a marketing group on an oral health video. And so that's actually underway, and we're expecting that video to be completed by the end of May. So be on the lookout for those two. And with that, are there any questions, any feedback on any of that before I hand it off to Dr. Rickert? No? Okay, awesome. All right, well, Dr. Rickert, she's the first female American Indian dentist, a member of the Prairie Band Potawatomi Nation. She attended the University of Michigan School of Dentistry and practiced in private practice and at the Family Health Care FQHC located in Baldwin. She is an adjunct faculty instructor and preceptor at the University of Detroit Mercy School of Dentistry and University of Michigan School of Dentistry. She is also a past president of the Resort District Dental Society. She's the author of Exploring Careers in Dentistry. She's written numerous articles and has served as a speaker and consultant. She's been inducted into the Michigan's Women's Hall of Fame and is a recipient of the Ida Gray Award from the University of Michigan School of Dentistry. Dr. Rickert, thank you for being here. Excited to have you.
Julie, thank you for that very nice introduction. And I thank you for this opportunity. I'm honored and excited to share details about the Anishinaabe Dental Outreach Program. Next slide. The Anishinaabe is the term Indigenous people used before 1492 to refer to themselves. Anishinaabe means original and good people of the Anishinaabemowin woodlands. The Anishinaabe speak Anishinaabemowin, and Anishinaabemowin means place of the big water. Before 1492, the Three Fires Confederacy in Michigan was comprised of the Ojibwa, the Chippewa, the Odawa, and the Potawatomi tribes. I am a member of the Prairie Band Potawatomi Nation. These tribes were excellent hunters and fishermen skillful intertribal traders, early farmers, and keepers of the fire. On a map of modern Michigan, there are hundreds of Anishinaabemowin names of rivers, lakes, towns, and locations. White Pigeon, Michigan is named for my fifth great-grandfather, a hero in 1828. Next slide. We Anishinaabe are still here in Anishinaabemowin, numbering approximately 350,000 people. Next slide. There are 12 tribal groups in Michigan with 12 reservations. There are several urban Indian centers and 3 Michigan Indian community colleges. There are 5 Michigan Indian charter schools, as well as indigenous support groups in our schools. And most universities and colleges have American Indian student clubs on campus. Next slide. The Anishinaabe Dental Outreach Program is an effort by Delta Dental Insurance of Michigan to address the disparate levels of oral health care between the Michigan Indian population and the general population. The oral systemic link, as you know, makes this initiative of paramount importance. When I visit the Michigan Indians, here is my presentation. Next slide. In BC times, we tribes took care of each other, provided for each other, and saw to the well-being of the whole tribe. BC is before Columbus. But we can do this also in the 21st century. Next slide. Together, we can promote healthy teeth, healthy humans, healthy tribes, and healthy Anishinaabe. Why is this important? Nutrition starts with the oral cavity. Speech centers on the mouth. Cultural exchange starts with the face, and the lower 1/2 of the face is dominated by the mouth. Today, I am talking to you and your tribe as represented by this Anishinaabe medicine wheel. The Anishinaabe medicine wheel represents the 4 stages of life: babies, youth, adults, and elders. And it reminds us that we are all connected in the circle of life, right here and right now. Next slide. Pregnancy is an exciting time. And what is best for the baby? The answer is, of course, a healthy mom. Excellent nutrition for the mom and the baby begins with healthy teeth. Rampant maternal dental disease can contribute to low birth weight and to increased likelihood of premature birth. Pregnancy hormonal changes can cause dental problems, especially gum disease. A dentist and hygienist can show moms how to prevent these problems. Do you know at what stage of pregnancy the baby teeth begin to form? The baby teeth buds begin to form in the 3rd month of pregnancy. And all the nutritional building blocks for healthy teeth are entirely supplied by mom. Next slide. Once the baby is born, breastfeeding is the most beneficial for nutrition and the development of facial muscles. Never, ever put baby to bed with a bottle. And we recommend cleaning baby's teeth as soon as the first tooth appears, which is a very exciting time about age 6 months. Next slide. Baby's first visit to the dentist should be before age 1 year old. This image shows a dentist and a mom performing a knee-to-knee oral exam. The mom holds the baby in her lap face to face. Then she lays the baby down onto the dentist's lap. She maintains eye contact with her baby, talking constantly to the baby. The dentist uses eyes and hands to complete the exam without instruments. The baby's focus stays on the mom. This same knee-to-knee position can be used at home to clean the baby's teeth. Next slide. Babies come into this world with sterile mouths. No germs or pathogens are in a baby's mouth when it is born. The germs come from family members. That is why it is of paramount importance for all family members to have excellent dental health and to model excellent dental habits. Next slide. What is the most common chronic childhood disease? Tooth decay, dental disease. Students learn better when they have excellent dental health. The most common cause for school absences in America is dental disease. And of course, these absences cause problems with learning because the student falls behind. Next slide. It is important for all children to visit the dentist twice a year. Dentists can apply sealants to virgin teeth. Sealants are like a raincoat for permanent teeth. Also, fluoride applications prevent dental decay. Hygienists and assistants provide toothpaste, brush, floss, and model excellent oral hygiene for the child. Next slide. Provide food which does not cause dental disease. Use the My Plate nutritional guideline developed by our federal government. Drink only water and milk. This Rethink Your Drink exhibit is a good visual aid. Babies and kids do not need white sugar. The Anishinaabe used only honey and maple syrup, very sparingly and very seldom. Babies and kids do not need white sugar. Next slide. A great way to focus on childhood dental health is to celebrate National Children's Dental Health Month, which is in February. Of course, I recommend the celebration continue for the whole year. There are many educational aids to teach children about excellent dental health, including games, coloring books, puzzles, and now videos. Next slide. The teenage years can be a dangerous time for oral health. We all need to discourage dangerous habits such as alcohol consumption, illegal drug use, and tobacco habits. Tribal leaders have told me they are very concerned about the new scourge of vaping. They tell me vaping is on the rise among Anishinaabe youth, and there are vaping damages to the oral cavity. There are terrible burns and injuries that can happen on the lower 1/3 of the face. And oral surgeons have a very difficult time effecting repairs to these burns and injuries. The result can be disfigurement for life. So we must discourage vaping and smoking by modeling good behavior. That means all of you, all of us, quit smoking. Next slide. And speaking of role models, we are encouraging dentistry as a career for tribal youth. But many tribal youth have never seen an American Indian dentist. In fact, I am still the only American Indian dentist licensed in the state of Michigan. In the United States, there are about 450 American Indian and Alaska Native dentists. In order for there to be parity with the general population, there should be 5,000. And we at the Society of American Indian Dentists are doing our best to reach our youth. Next slide. We want them to know that dentistry is a noble profession that impacts the lives of patients from ages 2 to 112. I'll make that age 1 to 112. It has helped us to achieve excellent dental health and brilliant, attractive smiles. Dentistry is a complex combination of science, art, chemistry, and engineering that is ever changing. The feeling of exhilaration and accomplishment I have at the completion of a complex case is indescribable. My fellow dentists are smart, talented, decent, honest, and always interesting. And we get to share our professional lives in professional offices with smart, capable staff. Best of all, every day is different. We never know who is going to walk through that door. But a young person can't decide to become a dentist or any other health professional when they are in college. If our youth are interested in becoming a health professional, they have to start working toward that goal in middle school and high school by taking advanced placement classes in math and science. It's late to build that foundation when you are a junior in college. The good news is the curriculum to become a dentist will also enable a great career in science, engineering, astronaut, or in all health professions. Next slide. So my challenge to all of you is to encourage any youngster in their quest for a brighter future. Today's middle school student will be your dentist in 20 years. So talk to the best students you know. Suggest to them they talk to their dentist. I can almost guarantee you that dentist will take the time to mentor them and answer their questions. Next slide. Recognizing the need for mentoring exposure to the dental profession, dental schools are now offering pre-dental workshops for Black, Indigenous, and people of color college students. For example, the University at Buffalo School of Dental Medicine offers the Destination Dental School Week on campus in New York, where college students take classes at the dental school. They are paired with a dental student. Dental professors explain dental school prerequisites and the preparation needed for the dental aptitude test. Professors discuss scholarship opportunities and ultimate career goals. This is an annual in-person program and there is no cost to the participants. So if you know of a likely candidate, please inform them of this opportunity. Next slide. For adults, the oral systemic connection has been proven epidemiologically in all populations. The incidence of chronic diseases in adults is higher and more often untreated in the Anishinaabe and in all American Indians and Alaska Natives. Untreated dental diseases worsens all diseases and illnesses. Here are some examples: diabetes, obesity, cardiovascular disease, stroke, respiratory disease, and cancer. And of course, at this time, we talk about the pandemic. Oral chronic inflammation worsens the effects of the COVID-19 virus. Unfortunately, in 2019, American Indians and Alaska Natives in the United States had the highest death rate from COVID. Next slide. In American Indian and Alaska Native elder populations, there are many dental disparities, including higher rates of complete tooth loss without dentures, teeth which are ground down, dry mouth, diminished sense of taste, root decay, gum disease, jaw bone loss, tissue inflammation, active infections, and oral cancer. Next slide. Access to professional oral health service and oral health education, along with excellent daily dental hygiene, are key factors that can improve the oral health of our elders. Remember our goal: healthy teeth, healthy humans, healthy tribes, healthy Anishinaabe. Next slide. Our elders believe the purpose of their lives is grandchildren. So the Anishinaabe Dental Outreach asked them to be engaged with the younger generations in promoting healthy teeth, healthy humans, healthy tribes, and healthy Anishinaabe. We asked our elders to participate by talking to their expectant family members and even talking to expectant parent classes. We asked them to read aloud dental stories to preschoolers and work on puzzles and coloring books with dental themes. We asked them to volunteer at local schools to distribute dental supplies to youngsters. And we asked them to model excellent and frequent toothbrushing and flossing. Next slide. People who interact with us want to be culturally competent. One way is for us to reach out and celebrate National Native American Heritage Month in November with our local schools, our libraries, our YMCA, scouting groups, churches, boys and girls clubs. We can ask the tribal media to include dental topics in November, and we can ask the local mainstream media, such as radio, newspapers, and television, to feature Anishinaabe news. Next slide. We Anishinaabe people are now working with many other people outside the tribes, and we would like those people to be culturally competent when we interact with them. They need training. As you know, the Southern Plains Tribal Health Board has developed an online course that can help people to expand their ability to communicate and to work effectively with American Indians and Alaskan Natives. These principles apply to all people who want to interact more effectively with many other cultures. Next slide. The Anishinaabe Dental Outreach Program uses Anishinaabemowin when teaching about how to protect your children against the most common chronic childhood disease, and that is dental disease. Our Anishinaabemowin expert is Kenny Pheasant, and he translated this dental information from English. This is the first time this has ever been done with any health education, and it is a point of pride for Michigan Indians. The poster has been hung up in tribal clinics and urban Michigan Indian centers and is used at Michigan tribal colleges, Michigan charter schools, and in Anishinaabemowin classes. Next slide. I rejoice every day, thankful for the amazing life that dentistry has afforded me. We have a fabulous family. I have 3 children and 11 grandchildren. I have a lovely home, fantastic opportunities, remarkable friends and colleagues. This admirable and noble profession of dentistry has been extremely beneficial and enjoyable to me. And I want this for every Michigan Indian, for every American Indian, and every Alaska Native. And the Anishinaabe Dental Outreach is a starting place. I thank you for this opportunity to present the Anishinaabe Dental Outreach. Together, we can promote healthy teeth, healthy humans, healthy tribes, and healthy Anishinaabe. But I am only one person. The Anishinaabe Dental Outreach needs help. What are your ideas? What are your suggestions? Please let me know. And let's remember what the Anishinaabe people say. Our people are as a great river flowing from forever to forever. The river comes from drops of water, from the sky, from the hills, from the springs. Each individual drop is insignificant, almost nothing. Yet, when they all come together as a river, it cuts a path through anything in its way, even granite. Individuals come into this world like drops at some point, flow along as part of the river for a while, and later leave it like fog or haze. A small contribution is made, and the river goes on. I thank you for your attention, and if you have questions for me, I will be glad to answer them.
Thank you so much, Dr. Rickert. That was fantastic. I want to open it up to see if there are any questions. I have a couple, but I'll wait and see if anyone here has any questions before I start in with mine. And feel free to put those in the chat box as well. Okay, well, hearing none and seeing none, Dr. Rickert, you had mentioned the Society of American Indian Dentists, SAID, and some of the work that they are doing to reach American Indian, Alaska Native youth to get them interested in dental professions. Could you talk a little bit more about that work and what SAID is doing and your involvement with SAID?
I'm currently a board member in the said board of directors, and they are trying to move forward after this pandemic that put some things on hold. We did some things by Zoom like you're doing right now, but we hope to get back to do more in person. Now, the dentists who belong to SED, they have gone to various dental schools in the United States. There are 52 dental schools in the United States. So they've approached their deans, letting them know that we have to reach out to American Indian students. And we have gotten a lot of cooperation. I did mention the University at Buffalo School of Dental Medicine. I've been working with them, but at the University of Michigan, they have a program, and University of Washington's dental school, Harvard Dental School, some of them have contacted the SED to ask for direction because they want to be culturally aware and, do it in a good manner. So we have gotten good requests from the dental schools, and we appreciate that. So now we are reaching back to our tribal members. I reach back to my own relatives and my own tribe so that we can make that connection for them. We have pre-dental student membership available at the Society of American Indian Dentists. We have pre-dental, I did say that, pre-dental, and then we have dental student membership available too. And Dr. Nancy Rifle at UCLA, she has been able to get a grant so that the pre-dental and the dental students can come to our annual meetings, and they can come with no charge to them. So it really helps them, because if there's only 450 of us in the whole country, they need to have support from people who are like them and who have gone through what they are going through. So those are some of the things that we're trying to do.
Okay,
if
great.
you have any ideas to reach high school, middle school, and college kids, let us know.
Yeah, I mean, and that's something that I'll say that the Native Oral Health Network and stuff, it's something that we've talked about with our steering committee members, and and potentially kind of going that direction as well with like an outreach program. So yeah, that's definitely something that we have talked about and is on our radar. I'll say that I know Amanda's on the call with her research, that some preliminary results from her literature review showed that American Indian Alaska Natives represent about 0.2% of the oral health workforce, kind of based on her findings. And Amanda, if I got that wrong, please let me know. And so I guess my other question is, do you know how, just because coming from, our position here within the Tribal Epidemiology Center, is SED, and maybe not just SED, maybe just to your knowledge of other organizations, collecting the data on American Indian Alaska Native representation in the oral health workforce? Do you know, if that's happening, or where?
We are not specifically collecting that data. We often are asked those type of questions by the American Dental Association and the American Dental Education Associations, especially we've been asking their help. So they want to have those facts and figures. We do not collect those. We quote you a lot, and other sources, universities that have done epidemiological studies of Native American health. So no, we do not collect and analyze data. We have one executive director. That's our only employee. So her keeping the organization running, organizing meetings and things like that, we really don't have the ability to collect data.
Yeah, that's a lot for one person. For sure. Yeah, and I think that's something that, our discussion with like our steering committee members, which our steering committee members, we have 8 of those, and they represent different areas of the country. So in the Great Lakes area, we actually have Gifty on. She's one of our steering committee members there from the Great Lakes area, and then from Northwest area, from the Northwest Portland area Indian Health Board, in New Mexico and Oklahoma, and always looking to kind of expand. But from our conversations with our steering committees and other members, it's definitely a huge gap, a data collect, a gap that I do know is is something that we need to look further into. And I know that we're kind of having those discussions and kind of looking into that too. So I wanted to, okay, so Matt, hi Matt. He put in a question here. Matt, you can unmute or I can read your question.
Sure. Oops, I'm trying to, there we go. Sorry about that. Hello, everyone.
Hi.
Hi. So thank you. This has been fantastic for me, just sort of, learning more about this. I'm not a member of a Native community, but at the ADA, I'm a legislative liaison. So I'm one of 4 people in the State Government Affairs Department that tracks state level legislation for a variety of issues. And one of mine is Native American, legislative that affects Native American communities and oral health. So Dr. Rickert, I know you know Dr. Grover, obviously, but one of the things that we'd like to do at the ADA level in particular is have a more consistent presence with Native communities that involves more than just, attending the blanketing ceremony, which I know we do, and I'm planning to attend the said annual meeting in June. But, what we'd like to do is put together a regular, group or council that meets to frankly just listen to the needs of Native communities and see how we can be helpful, again, consistently, rather than just sort of parachuting in when it's convenient, because I know that's been a source of some concern. So I guess it's part question, part appeal for assistance of some kind, because I'd like to work with you in identifying who you think might be best to do that. And hi, Janice. Hello. I'm copied on some emails from you, I think, but this is perfect. I'll get in touch with you as well.
I guess back to the question that Julie was talking about, when the SED or myself are asked to give information. Often that information is data type things. Often that's 10 and 15 years old, because for us to be able to go through many universities and many public health schools and things like that, we really don't have time to do that. So I guess when you Google something in and it comes up and it's a reliable source, then we use that. And it can be old data. And that is frustrating to us. But again, we can't collect our own. We don't have the manpower to do that. All of the members of the Society of American Indian Dentists, they're in many states. They are very knowledgeable, they're very smart, they're very competent, and they would be willing at their state level to work with their state component of the American Dental Association, and they would be willing to work with Dr. Grover or yourself, especially when it comes to reaching tribal youth, because I do know the Michigan Indian Charter Schools, I know the Michigan Indian Community Colleges and things like that. So I think every member of the SED would be willing to work with you, and we would go through our executive director, who is Janice Morrow, and she knows who's in what state and things like that. I know out in Oklahoma, there's lots of American Indian dentists there. I mean, I think there are, but when you get to other states like Montana, Michigan, Wisconsin, there aren't very many. So I would reach out to Janice and find out the names of dentists that are in various states and work with them with whatever their issue, which is probably going to be similar and all over, but at least it's going to be localized to their state.
Thank you. I appreciate that. And by way of background, before I was with the ADA, I was with the Wisconsin Dental Association. And
oh, okay.
Yeah. But I always found it interesting how little interaction there was at all between the Native community and organized dentistry, because obviously there are a number of tribes in Wisconsin, a couple of whom had their own clinics on tribal land, and the engagement was just, it's not there at all. And there was very little interest, even from, my boss and a number of the other dentists. It was just sort of like, well, why? And I think that's unfortunate. So we'll work on that. So thank you.
Right. Well, the reason that the Delta Dental in Michigan contacted me is because of the disparate levels of health. Like I said, there's so many American Indians that are edentulous without dentures. And they have a population health management and utilization department. That's a mouthful. But they want to try to address that problem. And I suggested they address that problem by having more American Indian dentist health professionals, but that doesn't happen overnight. So it's a long-term, long-range goals.
Well, Matt, thank you for your question. Thank you, Dr. Rickert. I think it's good to kind of see this collaboration and more involvement of Native communities in these conversations. So thank you. And Gifty, I'm sorry, I didn't mean to skip over your question. I'm seeing that now. So I'll ask that for you to Dr. Rickert. So Dr. Rickert, who and what motivated you to become a dentist, and how do you think other Native communities can encourage pursuing a career in dental health among their members?
I graduated from dental school in 1975. And there was one American Indian dentist at that time, Dr. George Blue Spruce. And I believe I'm correct to say that he graduated in 1958, around that time. So prior to 1958, there were no American Indian dentists. So it's been a slowly developing process. Now, for myself, I was very fortunate in that I had a pediatrician who was very kind to our family. I'm from a big family. I'm the oldest of 7 children, and he was very kind to us. And he knew that I was getting A's in math and science and excelling in my local high school, junior high school. So he said, why didn't you come on a Saturday and visit in my office? So I did. So I was reading his anatomy books and physiology books and things like that, and asking him questions. And he said, Jessica, I think you could be a doctor. So that was the first time, and he was a white man, but that was the first time anybody suggested to me that being a health professional was a possibility, because I didn't really know what was involved in becoming a doctor. So I began to ask around my high school, and I went to a public school in Michigan, Western Michigan. It was a small public school. There were 125 in my graduating class. So it wasn't any kind of, specialized school or anything like that. And so I applied to the University of Michigan, and I was accepted. And during that, in the fall of 1968, and I was the only student from Wyoming Public Schools who was accepted to the University of Michigan. And then when I got to the University of Michigan, I realized that I had to visit the medical school, but then the pharmacy school, the nursing school, and the dental school had open houses on some Saturdays. Just anybody could go there. So I went to all of those schools to see what it was like, because I wasn't convinced I needed to be a medical doctor. I wanted to be a health professional. And when I went to the dental school, I was just fascinated. So I went back a couple times, and they paired me up with a dental student, and he showed me he was casting a gold crown, and it was just fascinating to me. So I thought, I think I can do this. Actually, since my pediatrician said to me, I think you can be a doctor, and this is maybe key, is I never had a doubt in my mind that I could do it. I knew I could do it. And so that I applied to dental school, and they walked me through the application and told me I had to take a dental aptitude test. I mean, I didn't even know a thing about the dental aptitude test. I knew nothing, since my parents were both factory workers. And so they did help me through that. And when I went to dental school, there were very few Blacks, no Indians, obviously, no American Indians, and very few women. So it was not an easy time, but I did receive an excellent clinical training at the University of Michigan, for which I am grateful. This is a long way to say that I went to a small public school. It wasn't specialized, but I was completely prepared to compete at dental school. And I thank my public school for that.
Oh, thank you, Dr. Rickert. That's really, really inspiring. And thanks, Gifty, for your question. Give it just a couple of minutes. I know we've got about 10 till noon Central Time. So if you guys have any other questions for Dr. Rickert, let's put those in the chat, or feel free to unmute as well. In the meantime, Dr. Rickert, do you have, can we share your contact information in case someone has any kind of follow-up questions or thoughts? Can we share that here in the chat?
Yeah, that would be good. And I was just making some notes to myself. So yeah, you have my contact information, my email and things like that. And I was hoping that maybe I could get a list of the attendees who are watching this today, because you would mention different groups, and I know that they are working on the same issues. So that would be when I have a question like, might this work or might this not work? Or if the Society of American Indian Dentists wants to reach out to a certain region, then we would have that list. That would help me.
Okay. Yeah, absolutely. Alex, will you put Dr. Rickert's email in the chat? I know Dr. Rickert, she's on her phone, so that might be kind of hard.
Okay.
For her to
All right.
Okay. Yeah. Well, thank you again for sharing your message and all of your work. I know you're certainly an inspiration, you know, to all of us, and kind of how you kind of trailblazed as a Native American dentist, being the first female Native American dentist. So so very much appreciate all of your work and sharing that with us today. And then also, you know, the continued networking and collaboration even afterwards. So thank you for that. Okay, so in closing, let's see, just a couple of follow-up things. So our next R&R with NOHN, again, we do these quarterly. So the next one will be June 2nd, same time at 11 a.m. Central. Our spotlight this meeting will be our very own Gifty Crab. And so she's going to be talking about, speaking again, in terms of workforce and data collection. She's going to be talking about the Great Lakes Intertribal Epidemiology Center and their oral health workforce survey. So be sure to mark your calendars and tune in for that conversation and her sharing her work. And they're doing great things there at Great Lakes Intertribal Epicenter. So that's June 2nd at 11. Make sure you're receiving known newsletters. Because any updates, all of our resources, everything gets funneled through that communication, and that comes out monthly. So make sure you're kind of staying in the know with that. And if you're not a known member and you want to stay in the loop with the newsletters and all of the work that we're doing, there's the form here. Alex will put it in the chat box. That's our membership form. I mentioned OPEN earlier, which is the Oral Health Progress and Equity Network. This is a great group to network and to collaborate with. There's just about something for everybody in terms of Medicaid, Medicare, public perception of oral health, I mean, all kinds of policy stuff. There's I think there's a children's learning group or learning collaborative. So there's so much information, so many resources. If you're not already a member, please do that. Alex will put those links in the chat as well. It's free to become a member, and you can do that through the website that she's going to put there into the chat. Follow us also on our Facebook and Twitter accounts. Those are listed there. And I believe that Alex put in the post-meeting evaluation. If you would just take literally a minute, if that, to fill that out, that really helps us to kind of to have a little bit more direction and feedback for how these meetings should go and what works best for you all. So that is all that I have for today. If we'll stay on we'll keep the Zoom room open for about 10 or 15 more minutes for anyone who wants to hang on and chat or connect directly with any of us here or have any other questions for Dr. Rickert. I appreciate everyone being here today. This is recorded. We'll put this we'll share this information out with our other members and hope to see you guys next time.